Hi, I'm Craig Phillips, the Director of DMA Clinical Pilates and Physiotherapy, and I'm here today with you to share some very exciting news about clinical Pilates exercise treatment management compared to general exercise and general Pilates. There's been a lot of discussion in the past 25, 30 years regarding Pilates. Is it any superior than general exercise? And the research hasn't really come up with anything until now. With DMA's approach, looking at subgrouping of patients based on a directional model, that is, every patient is different in their response to load, the big discussion at the moment. We can subgroup these patients with a high inter-rater reliability of 0.87 kappa into subgroups, then comparing this with general exercise, which has no subgrouping, and general Pilates, which is similar. The subgrouping process in this, which is a 3-arm double-blinded RCT, was to look at, first of all, matching patients at baseline and then randomizing them to one of 3 groups. The directionally specific, that is unilateral, unidirectional exercise, versus the general Pilates, which is multidirectional, bilateral exercise, and general exercise, which of course is the same, multidirectional, bilateral, non-specific. There was a 6-week intervention period, followed by a 6-week maintenance period with final follow-ups taken. Of this, cutting to the chase, looking at pain, one of the main factors with treatment, the baseline matching of the 3 groups here showed a significant improvement at the P001 level with the clinical Pilates down to 0.06, less than 1 from a 4.28. There was some improvement with exercise in the general groups, which is commonly seen. Exercise is better than doing no exercise, but this significant difference showed the superiority of the clinical Pilates subgrouping approach. On patient-specific functional scales, same thing, a baseline matching showed a measurable but non-significant improvement in the 2 groups with wider variation in response in the general exercise, a much tighter response here, and again, significant at 0.001 improvement in function from the clinical Pilates group. Finally, on the Oswestry, looking at disability index, same thing, baseline matching, some improvement in the general exercise groups, but a significantly greater improvement in the clinical Pilates group. So we can now say with significant confidence that DMA Clinical Pilates is significantly more effective than the general Pilates and general exercise groups in clinical and objective outcomes. This is going to change, of course. This is the game changer. Looking at low back pain and other injuries, looking at chronic conditions that haven't been responding to treatment. Is there a better way where we can subgroup rather than applying generic programs expecting better outcomes? So look forward to dealing with you and working with you more on this. We'll tell you when the full meeting, the paper is out. And of course, look forward to the future, which is looking very bright on a much greater scale. Thank you.